and sorry, and my dear fellow colleague, a very good morning to you all. I am Dr. Eshona on behalf of Weekly Journal Club presentation, Department of Pathology, BSMMU. Welcome you all to the presentation. Our today's topic is concentration of lymph node aspirate improves the sensitivity of acid-fast smear microscopy for the diagnosis of tuberculous lymphadenitis. This presentation is being supervised by Dr. Soumitra Chakraborty, Assistant Professor, Pathology, BSMMU. We have Dr. Nafisa Sharmin, Phase A, Year 2, and Dr. Tasmia Islam, Phase B, Year 3, as panelist 1 and 2 respectively. Today's resident chairperson is Dr. Tanushree Pal, Phase A, Year 2. Our program is divided into two halves. In first half, after the main presentation, there will be a question-answer session. Then we are going to listen speeches from panelists 1 and 2, and then from resident chairperson. Next, we are going to be enriched by the session from our Honorable Chairman, Dr. Firdausi Begum, Associate Professor, Pathology, BSMMU, and from other respected teachers. Now, I would like to request Dr. Niamul Haq to present his part.
Thank you, Dr. Ishana Paul. Assalamu alaikum to Honorable Chairman, respected teachers, senior, and my dear colleague. I am Dr. Niamul Haq, Resident Year 1. Welcome to today's journal presentation. At first, in short about tuberculosis. Tuberculosis is a serious chronic pulmonary and systemic disease caused most often by Mycobacterium tuberculosis. Tuberculosis is the major public health problem in Bangladesh since long. Now, about pathogenesis, mainly I describe here the primary tuberculosis pathogenesis and how granuloma is formed. After inhalation of the organism reach the alveoli of the lung, then organism enter into the macrophage by binding with several receptors expressed on macrophage. Then formation of ineffective phagolysosome, which causes unchecked bacilli proliferation, resulting in bacteremia with shedding of multiple sites. Then alveolar macrophage present antigen to T helper cell, and T cell activate T helper cell, which release gamma interferon, and this gamma interferon activate macrophage. This activated macrophage kill microbacteria by maturation of phagolysosome and activation, production of nitric oxide, reactive oxygen species, and autophagy. In addition, this activated macrophage differentiate into epithelioid cell and formation of granuloma and caseous necrosis form. This is a microphotograph of tubercular granuloma with caseous necrosis, which is taken in our department. And this photograph of AFB cytology of Jaden stain. Now background. Tuberculous lymphadenitis, most common extrapulmonary tuberculosis. FNAC is simple and rapid diagnostic technique, but of low specificity. Direct Jaden method is the cornerstone for diagnosis of pulmonary tuberculosis in developing country, but its sensitivity in extrapulmonary tuberculosis is limited. Microbial culture is the gold standard method, but it's time consuming and expensive and require specialized safety procedure. Concentration method of lymph node aspirate for AFB smear microscopy have significantly higher sensitivity than direct microscopy. Now methodology. Place of study, Southwest Ethiopia, Jimma. Published on 3rd September 2014. Total number of cases 200. It is a cross-sectional comparative study, diagnostic method, FNAC, direct Jaden method, microbial culture, and concentration method. Now about concentration method for detection of AFB. At first, FNA specimen is decontaminated and digested with 1% N-acetyl L-cysteine 4% sodium hydroxide and 2.9% sodium citrate solution. Then concentrated by centrifugation at 3000 gravitational force for 15 minutes. After centrifugation, the supernatant is decanted carefully and 2 to 3 drops of the sediment are placed on a clean slide, then stained with Zn staining. Now thank you. Now rest of the part of the presentation is proceed by Dr. Pawan Shah.
Thanks a lot, Dr. Nangu, for the nice presentation. Assalamu alaikum to the honorable chairperson, respected teacher, seniors, and my dear colleagues. This is Dr. Pawan Shah, President Year 1, and I would like to continue the rest of the presentation. Here comes the result of the concentration method. The sensitivity and specificity of the direct Zn stain concentration method and cytology against culture. On direct Zn staining, we got the sensitivity about 34.6%, whereas the specificity about 98.2%. And by the concentration method, we got the sensitivity about 66.1%, whereas the specificity about 87.5%. And in cytology, we received 90.6% sensitivity, whereas 44.6% the specificity. Now, here comes the incremental yield of acid-fast bacilli grading on concentration as compared to the direct microscope. Here, among 26 smears which is graded as anti by direct Zn method, 14 were increased to 1 plus and 9 to 2 plus by 9 to 2 by the concentration method. Similarly, among 14 smears which is graded as 1 plus by direct Zn method and 9 were increased to 2 plus by the concentration method. Here the scanty means the 1 to 9 bacilli per 100 oil immersion, whereas 1 plus shows 10 to 99 per 100 power field. Here the 2 plus shows 1 to 10 per field, whereas 3 plus shows more than 10 per field. Here now it comes to correlation of cytomorphological features of tubercular lymphadenitis with direct Zn method and concentration method. In this result, we observe the highest rate of acid-fast bacilli positivity in a smear showing necrosis without epithelioid cell, and lowest in case of a smear showing epithelioid cell without the necrosis. And here is some message that we can take home, as the sensitivity of the concentration method is significantly higher in comparison with the direct smear microscopy. And it also, in addition to the routing cytology, the concentration method can increase the diagnostic yield of the tubercular lymphadenitis. And thank you all. Thank you, ma'am.
Thank you, Dr. Niamul Haq and Dr. Pawan Shah, for your excellent presentation. Now it's the time for question answer session. Audience may send question via chat box, or they may unmute themselves and ask directly. Our respected teachers also can ask question if they want. Now I would like to ask question from audience. Please ask your one.
Assalamu alaikum. I'm Nafisa Sharmin, Phase Year 2. I have a question regarding this. If the aspirate, lymph node aspirate concentration has not done yet in our department, is there any information about the sputum concentrate done in any department of BSMMU, like microbiology or pathology?
Thank you for your nice question. We have no idea about this. Any other departments it's done or not done?
Dr. Niyamul, you were placed in microbiology department. Have you seen there?
No, madam, we have not seen.
Okay.
Thank you very much.
There is another question from Dr. Kasim Haji. Is concentration method of lymph node aspirate cost effective compared to other methods?
Thank you, Dr. Kashim Haji. In the journal, there is no idea about the cost, about the reagent, and we have no information get from internet about the cost effective of this chemical reagent in this method. Thank you.
Dr. Niyamul, would you kindly describe the procedure of concentration method, how the aspirated material is concentrated, the method?
Yeah. At first, FNA method was mixed up with decontaminate and digest with 1% N-acetylcysteine, sodium hydroxide, and sodium citrate. Then concentrate it, then
slowly, slightly slowly.
Then centrifuge it. After centrifugation, supernatant was decanted, then sediment we are taken at the slide. Then after preparation of the slide, we stain with Jaden staining, and we see under microscope in 100 power field.
So you need only one reagent, that is 1% what? Repeat.
N-acetyl L-cysteine.
Okay, go for try to know the cost of this reagent. Okay.
Yes, madam.
Next, Dr. Salma Shabnam asks that why sensitivity increased in concentration method?
Thank you, Dr. Salma, for your question. It's due to liquefaction of the sample followed by centrifugation, which increase the smear sensitivity.
There is another question from Dr. Sajjad Hussain. Why AFB positivity is highest in smears of necrosis alone?
Thank you, Dr. Sajjad, for this question. We got the why is positivity is higher in the case of a smear alone. This may be probably due to central necrosis portion of the tubercle that contains the more bacilli at the center.
Dr. Iftikhar is asking, would you please explain that as a lymphoreticular organ, whether the bone marrow trephine biopsy might be helpful in diagnosing tuberculosis or not?
Thank you, Dr. Iftikhar Ahmed. We have no idea about this, and in this journal only mention about the tubercular lymphadenitis. Mainly here is cervical lymph node is mentioned.
Okay, Dr. Niyamul, you should go for detailed reading of knowledge of pulmonary tuberculosis. Pulmonary tuberculosis, these
Madam, we cannot hear it.
Madam, please unmute yourself.
In disseminated tuberculosis, you will get tubercle bacilli in the trephine biopsy also.
Yes.
Dr. Reshona, proceed.
Yes, ma'am. There is another question from Dr. Ishrat Liza. Is less time required to diagnose tubercular lymphadenitis by concentration method rather than conventional Zell-Nielsen staining?
Thank you, Dr. Ishad. It may take time due to centrifugation. In ZN method, we did not centrifuge, so it's for time for centrifugation we needed.
Our next question is from Muhammad Akhtaruzzaman. Dr. Muhammad Akhtaruzzaman is asking, can we apply this method for other microorganisms too?
In this journal, we only about it may be applied on other acid-fast bacilli like nocardia or like other acid-fast bacilli, nocardia and actinomyces.
May I add something?
Yes, ma'am.
What are the causes of granuloma? What are the infectious causes of granuloma?
Madam, tuberculosis, syphilis, cat scratch disease.
In Bangladesh, what are the infections that are common in Bangladesh? What are the infection? I mean, what are the granulomatous inflammation or infection? Granulomatous inflammation. What are the common causes of granuloma in Bangladesh? You know that there are two types of granuloma. One is foreign body and one is immune granuloma. And foreign body granuloma is more common than the immune granuloma. In case of immune granuloma, pulmonary tuberculosis is common, but fungal infection is also common. So any panelist or chairman of this session, do you want to add something regarding this answer of this question?
Yes, ma'am. Ma'am Tonusri. There are some acid-fast organism that may mimic acid-fast bacilli and confuse our diagnosis, such as not acid-fast bacilli, they are also first organism, such as nocardia, then deep fungus, yeast form, blastomyces in 60% cases and 47% cases, histoplasmosis can take AFB stain. Then bacterial endospore, such as cornybacteria, may take AFB stain. Then Legionella and certain parasites, such as Cryptospora, Isospora, and Cyclospora, they take AFB stains. So this can lead to misdiagnosis. And hydrosis cyst, especially their hooklets, stains irregularly with ZN stain. So these are acid-fast organism or structure. And atypical mycobacteria, they are also stain positive with ZN stain. So the difference by concentration method is not possible. So here in the journal, they mention in this case where tubercular lymphadenitis or non-tubercular disease, the main way to differentiate is culture. Thank you, madam.
Thank you, Tanushree.
Thank
Proceed,
you.
Dr. Eshona.
Yes, ma'am. Thank you, Dr. Tanusripal. There is another question from Dr. Mahmouda. She is asking that, can we use the concentrate as a culture material?
Thank you for the question. Yes, we can use for the culture material.
Is there any more question? Is there any more question? Okay, I think there is no more question. Now I would like to call Dr. Nafisa Sharmin, panelist 1, to deliver her speech.
Thank you very much, Dr. Ishina. Honorable Chairman, respected teachers, and my dear colleagues, Assalamu alaikum and a very good morning to you all. I am Dr. Nafisa Sharmin, Phase A Year 2 resident of Pathology Department, BSMMU. Thank you, Dr. Niamul and Dr. Pavan, for your excellent presentation on the topic. Concentration of lymph node aspirate improves the sensitivity of acid-fast smear microscopy for the diagnosis of tuberculosis. Today, I'll briefly discuss my views about the feasibility and applicability of this method described in this article in our department, and whether this can be implicated or not. The presenters have mentioned that the sensitivity increases when the cytomorphologic features of FNA was epithelial cell aggregate with necrosis. By the concentration method, there is an increase of positivity from 61.9 to 73% in the presence of necrosis. But here in our department, most of the patients with suspected tubercular lymphadenitis come with a long time history. So by the time most of the patients develop in their microscopic features that epithelial cell clusters or granulomas that are already formed, that decreases the sensitivity of this concentration-based technique. However, considering many aspects, it can be beneficial, this process can be beneficial for us, as though the ZN stain smear plays a key role in the diagnosis and monitoring of the tuberculosis patient, but due to their low sensitivity, this is the main disadvantage of ZN smear, that the low sensitivity, 20 to 43%. PCR and other molecular methods are highly sensitive and specific, but their evaluation in the low-income countries like ours have been limited. This method of concentrating the FNA samples have similar accuracy as the molecular method, but a low cost is required than the molecular method. Now, number 3, that though culture is the gold standard for the identification of the AFB, it is time consuming and requires the specialized safety procedure. As we should better think of a safer and cheaper, but more accurate and sensitive technique like the method we are discussing about here. Till now, this method is of concentration lymph node aspirates for making the AFB smear is not done in our department, or I know, as far as I know, in BSMMU. Considering our people's socioeconomic status, pandemic situation, we can start this procedure as a trial basis. The ultimate result is yet to be observed. Now I shortly highlight on the sputum sample about how to handle the sputum sample of TB patient in this pandemic situation, COVID-19 pandemic situation. The samples and diagnostic methods of tuberculosis and COVID-19 are different. As we know, the TB sample is sputum, and for the COVID-19, the nasopharyngeal swab or nasal lavage, etc. Facilities that diagnose the TB may receive the samples of the patients who may have COVID-19 infection. They may remain undiagnosed. So the TB lab personnel are in the increased risk of COVID-19 infection. As for this, the WHO has described some protective measures. Now, sputum should be collected in an open, well-ventilated space. The health personnel should stand at least 2 meters away from the patient during the collection. We have to strengthen and maintain the use of the biosafety measures and the use of PPE, personal protective equipment, for sample collection, transport, and handling. And handling should be performed in a class 2 biosafety cabinet. If the labs does not have the biosafety cabinet, then we must ensure the use of the N95 respirator, use of gloves, use of goggles and aprons, decontamination of the surface, and all the disposable materials must be autoclaved after the procedure. That's the end of our discussion. Thank you very much and stay safe.
Thank you. Thank you, Dr. Nafisa Sharmin. Now I would like to call Dr. Tasmia Islam, Phase B Year 3 resident, to share her thoughts.
I'm sorry to interfere. Dr. Tasmia Islam is performing frozen section, so she can't attend the session.
Okay, Dr. Reshona, you may skip this part and request your chairperson to complete her part.
Okay, ma'am. Thank you. Now, I would like to request Dr. Tanushree Pal, Phase A Year 2 resident, to deliver her speech.
Thank you, Dr. Ishana. Namaskar and good morning to our Honorable Chairman, respected teachers, and my dear colleagues. I would like to thank Dr. Nyamul for his present, Nyamul and Pavan for their pleasant.
Dr. Tanushree Pal.
Hello? Hello?
We can hear you, Tanushree.
Okay, madam, thank you. I would like to thank Dr. Nyamul and Dr. Pavan for their pleasant presentation. And at first, I'd like to thank our Honorable Chairman also because she gives the idea to our presenter to select the tuberculosis related topic. So in our outpatient department, every day, we get at least 10 to 12 cases minimum for suspected TB and presented with lymph node swelling, especially cervical lymph nodes and other lymph node also. So it is very important to know the diagnosis confirmation procedure. So this journal says that concentration method have higher sensitivity. So basically screening method it may be useful, but there are also some limitations that the journal highlights that they show that every positivity is higher in concentration method when the cytomorphological features of FNAC was necrosis without epithelial cell aggregates. That means in early lesion, it may not be useful. So for finding tubercular bacilli, we need the caseous necrotic material. As FNAC is a blind procedure, so FNA if we fail to obtain a representative sample or if we obtain very scanty sample, so this procedure may not be useful also. In this study, some factors are shown to be associated with highest smear positivity, such as duration. They have shown that average duration of 6 to 10 months has the highest smear positivity, where less than 5 months and more than 15 months are less positive. Then they have also shown that inguinal lymph node aspirates show highest smear positivity than others, where other journal shows that cervical lymph node is the commonest site for tubercular lymphadenitis. Then there is also aspirate material. Purulent aspirate material is more likely to be positive, smear positive. So there are these factors are associated for these factors are needed for concentration method. Another limitation for this concentration method is decontamination. the process of decontamination require some level of staff training. So, the chemical used here, such as sodium hydroxide and sodium citrate, they are proven to be health hazardous. So, one requires some level of biosafety arrangement to ensure the security of the lab person. Another thing is concentration method can't differentiate TB mycobacterial lymphadenitis from non-TB mycobacterial lymphadenitis. So these are the limitations for concentration method. And another thing is processing. As FNA aspirates, we must give in normal saline. So dilution is a fact which may give error. Dilution and improper decontamination also give errors in the result. So all these requires to be performed under a skilled supervision. So these are the limitation of this study. So all these from my part. Thank you.
Thank you, Dr. Tanushree Pal, for your enriched speech. Now, I would like to proceed to the teachers session. Our honorable teachers may ask questions, share their thoughts, or may guide us regarding this presentation.
Okay, thank you, presenters. Do you have any questions, Saika madam, or comments?
I think regarding the Dr. Salma, I think Salma asked that sputum. In sputum, yes, nowadays what actually the tubercular bacilli, very new technique, already PCR based analysis is done often. That's why culture rarely done. So maybe that's why you didn't see the procedure, but so far I can remember that in our time, yes, sputum culture, actually sputum is first treated with this N-acetyl L-cysteine and then culture is done. So it is practiced actually in microbiology also in outside the BSMMU and also in BSMMU, but maybe you have not seen because the culture is rarely done nowadays. That's why. So this information I can give you, and the presentation is, but presentation is, I think, a bit fast. Huh? You should describe slowly and very. I think it can be elaborated a bit more. Fast, very fast expressed and. Slowly further, but Dr. What is her name? Pawan. Pawan is okay, but Niamol is a bit fast, I think. So presentation, but otherwise it is okay, and it can be, of course, it can be practiced in our department also.
Yeah.
Yes, thank you.
Okay, thank you, Dr. Saika. Dr. Mushu, do you want to add something, because you will be the leading person of diagnosis of infectious disease in our department, in our
Thank you, madam. Dr. Nayamol, can we start this procedure in our lab? Is those chemicals, N-acetyl cysteine or sodium hydroxide or sodium citrate, or are available in our cytolab?
And no sites, the chemical reagents are not available in our cytolab.
All these three chemicals required for digestion, or any one of these?
For digestion, mainly an acetyl L-cysteine is required.
Not another two, sodium hydroxide or sodium citrate, not required. Only N-acetyl L-cysteine is required for digestion.
Rest of two chemical are required, maybe decontaminated the specimen.
You are not sure? Okay.
Yes, sir.
And then all the AFB smear positive slides are graded based on IUATLD scale. What is this scale? What is the importance of this scale? IUATLD. In your journal, they mention this scale. No information about this?
Sorry, sir.
Okay, thank you.
Sir, with your permission, I can help.
Okay.
It may be International Union of Tuberculosis and Lung Disease, sir. There may be scale according to this society. Grading of AFB, sir.
How they graded it?
Sir, they usually grade the number of bacilli per field, sir.
Then plus one, plus
Sir,
two, plus
yes, sir.
three, plus
Plus 1, plus 2, and plus 3, sir.
Okay, okay. I understand. Thank you.
Thank you, sir.
Dr. Vishnu, do you have any question or comment?
Thank you, madam. Actually, I have no question. Just I want to make a comment, madam, regarding this journal. This journal is from Jimma University of Southern Ethiopia. Near the Ethiopia, one of our residents from Somalia. So this region also covered in our today's journal presentation by the representation from the Somalia. So I want to mention one thing, that regarding all this diagnostic procedure, we have to remind that this is a preventable disease. So we have to always keep in mind that the prevention is better than cure. Though we develop all the diagnostic procedure, if this is a preventable disease, if, as we know that in Europe, America, it is very rare. So we have to always keep in mind that how we will prevent the spread of the disease, especially in this COVID situation. If we maintain the hygiene procedure, coughing sense, or if you are walking in the road of Bangladesh, you always found that everyone put the saliva within the road and coughing, as you know that they don't maintain any hygiene procedure or sneezing hygiene. So you have to keep in mind that it is preventable disease and we have to look for it so that we can prevent the disease. So in our ambition that no patient will be suffer from disease and this disease will not come to our department, and I want in some days there is no tuberculosis patient in Bangladesh and hope for the day. Thank you, madam.
Okay, thank you, Dr. Vishnu, for your comment and for your thought.
Madam, thank you, madam. Firstly, I'd like to thank the presenters and those who are associated with today's journal club for their efforts. Although I must admit that I do expect a bit more from our residents regarding the preparation of the journal club, because maybe this is the first time for the two of you, but the thing is that one has to go through some peripheral, one has to have some peripheral insights, not confined to the tunnel vision of the given article only. This is expected and it goes without saying. So maybe for the upcoming presentations, the presidents will keep in mind that everything that is discussed within the article needs to be further explored with further information, so that a few questions can be asked and they can answer, and they, above all they know about the thing in depth. And that's why the journal club is designed in such a way the presentation itself gets a very small time, but the discussion and everything, it gets a lion's share of the total duration. There is a reason for that. we expect to spend more time in question answers and discussions, so that otherwise it would not be fruitful. Now about something to clarify, some things I noticed in the question answer session. The residents were asking, but I felt that some of the things were not clarified enough. So for the residents, I'd like to add some information, like regarding bone marrow aspirates. It's actually around 50 to 60%. I don't know. I don't remember the exact figure, but the sensitivity from bone marrow aspirates, if you do a gene stain on it, you can have a sensitivity of 50 to 60%, which is not bad actually. But it's very specific. If you find, I mean, sensitivity measures that how hard it is to find something in a material. If it's in a very low number and you can detect it, then it means the sensitivity is high. And the specificity means once you find something, how likely to be as the accurate finding. So that is the specificity. So specificity is quite high from bone marrow aspirates. It's hard to find. Maybe 50% cases you will miss, but once you find a bacilli in a bone marrow aspirate, that's pretty confirmatory. So it has got high specificity, but mid-range sensitivity. And regarding the cost of adopting this method, the N-acetyl L-cysteine is basically very available. This chemical is quite available, and sodium citrate and sodium hydroxide, those are routine laboratory chemicals, so and not very much costly. The N-acetyl cysteine costs about I don't know, maybe 30 ml costs about $30, maybe something. 20% solution, which is used in ventilators for liquefying the mucus, the patients who have difficulty breathing. So this is a commonly used drug in critical care, and it's quite available. 20% solution in 30 milliliter vials, and the same principle is being applied here. Why? How does it increases sensitivity? That means increasing a sensitivity means identifying bacilli when it is in a lower number. So that means higher sensitivity. So how does this method accomplish that? Firstly, the same thing that the acetylcysteine does for the patients on ventilators having difficulty breathing. It liquefies the mucus. So it's a mucolytic agent. So this liquefies the mucus and frees the bacilli trapped within the mucus. And the next thing that it does, it uses a kind of buffer and also some keratolytic agents like sodium hydroxide and citrate, and it does a centrifugation. So without the mucolysis, the centrifugation will not be of help, because the bacilli will be trapped within the mucus. However you centrifuge, it will not liquefy. So the centrifugation and liquefaction combined provides a better sensitivity, and we can achieve that. Maybe I don't know, it's a quick back of the envelope calculation I just did. I may be a bit wrong, but it might add about 30 to 50 taka per test on top of the existing cost at our department. And these materials are not hard to get; they're quite available. So I think these are some of the inputs that I felt missing during the question answer session when the residents were asking quite interesting questions, and I'm happy to compliment on this thing. Thank you.
Thank you, Soumitra, for your contribution and thoughts. I want to ask a question to the presenter. Not. I would like to ask a question to Dr. Sajjad. Are you
Yes, madam.
Me?
Yes, madam. Yes, madam. I can hear you, madam.
Could you kindly tell me the title of your thesis?
My title of the thesis is comparative evaluation. Yes, madam. Comparative evaluation between conventional ZN method and modified bleach method to see the orbital evaluation of the AFB acid-fast bacilli. Madam, দুইটা মেথডের মধ্যে comparison, madam, to evaluate the detection of acid-fast bacilli in tuberculous lymphadenitis.
Do you think this method, this centrifugation
Sorry, madam. I can't hear you, madam.
Dr. Sajjad, who is your
Yes.
guide? Can you hear
My
me?
guide is Dr. Saika Habib, madam, and co-guide is Dr.
Oh, Saika Habib, madam.
Madam, my guide is Dr. Saika Habib, madam, and co-guide is Dr. Shomit.
Oh, তাহলে
And
তো
co-guide
হলো
is Dr.
ভালো।
Shomitra Chakraborty.
তাহলে do you think that you should add this method in your thesis, incorporate this method? What do you
Madam, I
think?
think I'm doing. Madam, I think the procedure I'm doing with is far better than the today's journal, because my the material that I will use is very much available and cheap. And today's journal there is a material like potassium hydroxide, sodium hydroxide. There is a chemical hazard, and these chemicals are not available everywhere.
A combination of three chemicals actually in
But
this
you are not
article.
willing to do this method. Okay. So now I have
Yes, madam.
one question. Why Mycobacterium tuberculosis positivity in culture is lower than that of the smear? It is
Sorry,
described in the journal. প্রশ্নটা বুঝতে পেরেছেন? Why the percentage of getting positivity in culture is lower than that of the method that you have described, that is the microscopy.
Please go to the slide with the sensitivity, specificity, the table, the slide that contains it, because to answer the question, you need to show that. One is the culture.
Culture. Culture you didn't add. Why? Where is the table? He didn't show the culture part in this table. He didn't show the culture part. That one important actually. The table is wrong.
Well, Dr. Niyamul,
Yes, sir.
Answer the question asked by Dr. Saika, madam, that what
Chairman madam asked. Yes.
also by
You can see your journal. Article. See the article? Table. You didn't. Table 1. Explain from the table 1.
In table, there is in culture there is positive and negative value. We could not understand that, so we did not add this part.
Anyway, Sajjad, do you want to
Madam,
add?
with your permission, I want to add something. Madam, earlier there was a question that the aspirated material is suitable for culture is not. Madam, after processing this aspirated material and concentrating this material, the bacilli may be not viable or dead. So this material after concentration is not suitable for culture. Though the culture is very much sensitive and specific and gold standard, but this concentration method is very much cheap, and we can get the result very rapid. And culture, we can get result after 2 to 3 weeks.
Okay, so, thank you, Sajjad. That means that you went through the journal.
Yes, madam. Thank you.
If there is any do you have any question? Anybody? I think we can conclude the session, okay? Thank you, everybody. for active participation.